welcome to Speaking of Horses, and today we are in Oregon. We're just a little bit south of Portland, Oregon. We are at Jake Price Stables and Equestrian Wine Tours, and I'm joined by Tom, and Tom is going to tell us all about thermal imaging here. We have a horse we're going to actually image and look at and learn all about this. And also from the stable, Sarah is with us, so welcome, Sarah.
Thank you.
And tell us, well, let's just take a brief second. Tell us about your wine rides.
We do equestrian wine tours in the Dundee Hills here, and all of our tours are done using Tennessee walking horses. Most of them are all retired show horses, and we also do carriage rides with some of our gypsy vanners and percherons, so that's what we do up here.
So come out and have fun, right?
Exactly.
Now, Tom, you are going to do some thermal imaging for us, so tell us a little bit about, we're going to go back here and look at a horse, right?
Absolutely. We are going to be actually demonstrating the technique on a live scenario.
Okay, we're going to learn about the equipment, about the process, and about how the veterinarians review the images and come up with the determinations for the horse. So we're speaking of horses. We are in northern Oregon. We are right outside Portland, maybe 20, 30 miles from Portland, and we're at the Jake Price Stable. So stay with us on Speaking of Horses. We got a lot coming right here. We at Speaking of Horses would like to thank the people who have made Speaking of Horses TV possible. To Equessentials, all your horse grooming, coat, and care products specifically designed for your horse. A thank you to King Barns, custom-built barns, any style, any project you'd like. Get a hold of King Barns. To Overland Carts, if you want that versatile utility cart for your stable that can do anything, check out Overland Carts. Stall Butler, a unique design on how you can muck your stalls and save 90% of your shavings for reuse. Check out Stall Butler. And Eagle Erie Equine, modular systems for saddle racks, tack bars, and the like. Totally organize your tack room with Eagle Erie Equine. Thanks to all of these fine people who make Speaking of Horses possible. Well, Tom, welcome to Speaking of Horses. Tell us a little bit about what your company is, what it does, and all about thermal imaging.
Mr. Williams, thank you very much for the question and the opportunity to present myself and my company to your fans. My name is Tom Cernansky, and I am the owner of Animal Infrared Imaging. We are a full-service, medical-grade veterinary thermography provider. What thermography is, it is essentially in veterinary settings. It is a diagnostic method designed for the early detection of animals. What makes us unique is that once our imaging session is done and we screened your animal, our findings are submitted to specially trained veterinary professionals, veterinary doctors called the thermologists, who are board certified in interpreting thermography results. Ultimately, the doctors formulate a diagnostic impression that is presented to the owner or the trainer, the breeder, or the primary veterinarian in order to formulate the final diagnosis as to what is the cause of the animal's ailment, injury, or disease.
Now, thermal imaging is actually you're sensing heat from the body. If you have an injury starting, that's generally a warmer place on the body, correct?
You are very correct. What thermography is all about, as the name is suggesting, it is about reading the thermal patterns, this heat signature of the living tissue or of the animal, and if there are asymmetries present, the thermologist will be able to determine the cause and, most importantly, the place where the injury.
So I understand this properly, Tom. The scan that you do, the imaging that you do, is based on the fact that injuries generally are warmer places on the horse, so that the heat is what shows up, and then you're determining what's causing that additional heat in that part of the body, right?
You are very correct, Mr. Williams. The essence of thermography is reading the heat patterns, the heat signature of the living tissue. And if there are asymmetries present, they would indicate the presence of certain injuries or diseases. Ultimately, the best documentation of this process is, for example, a inflamed knee. On a thermal screening, it would show as a area with increased temperature. In our case here, for example, we have a scan of a horse. However, this is a healthy horse with the thermal patterns in the normal range. However, as you can see, the horse shows warmer areas as indicated by the lighter colors such as yellow, red, even white, and the colder areas would be depicted by blue, red, or green. A injured or sick animal would show a inflammation in the form of a yellow, red, or white discoloration, or a nerve damage, as an example, by a darker area. Ultimately, what is the cause of the disease and where it originates is left up to the veterinary specialist, the thermologist, who is tasked with interpreting our findings.
Okay, so let's go look at a horse and see how this equipment works.
Let's try. Hi, thank you, Mr. Williams, for the opportunity to present my company. My name is Tom Cernansky. I am with Animal Infrared Imaging, and we are a full service medical grade thermal imaging service provider. My company is specializing in veterinary applications, and thermography specifically was designed for the early detection of animal lameness and hard to diagnose cases that originate from various injuries or accident.
Well, let me ask you this, Tom. So I've got a horse that's showing some signs of lameness or doesn't move right, won't pick up a lead correct. So you can take your system and try to give us a clue with the assistance of a veterinarian as to what's going on, right?
That is very correct. How thermography works, veterinary thermography works, is in two steps essentially. A thermal imaging session is being performed on the animal with the help of a thermographer, such as myself. I'm a clinically trained thermographer. And then the results are being submitted electronically for interpretation and analysis to a specially trained veterinarian called the thermologist, who ultimately formulates a medical impression of what is causing the animal's lameness, or where does the injury or disease in the animal originate.
So that's why this is considered a medical grade process, because all of these images are read by licensed veterinarians for interpretation.
You are correct. Actually, what makes us unique on the market is the fact that we are first and foremost working with highly precise and exact equipment that was manufactured for medical purposes. So this is medical grade equipment. And we are contracting with a team of specially trained veterinarians who've been board certified in order to be able to interpret the thermal screening into a medical impression or diagnosis.
So tell us a little bit about the equipment that's back there.
So this equipment right here consists of the camera, which is an infrared camera that reads the thermal patterns of the animal, and then ultimately each shot or each screen, each image is recorded on a computer. Once we have all the scans completed, and they have to be following a very precise protocol in order to have enough material that can be used by the interpreting veterinarian. So once we have all that material together and gathered, That is being submitted to the veterinarian, who analyzes it with a special program and formulates the medical impression.
So I have a horse that I think has a problem. I want to diagnose this early. I don't want this to become a larger and larger problem. So we do this process and we can determine in many cases the severity before it becomes severe.
Again, you are very correct on that one. Where thermography excels, primarily it's in the area of early detection of animal lameness, injury, or disease. It also is very helpful in as a adjunctive tool to focus in on the answers to the questions: where does the pain originate or issue originate, and what is causing it, in a scenario where the injury or the disease is hard to diagnose.
So you have basically the computer which reads the imaging from the camera, and then you get these reports which are then generated and sent to or viewed by, at whatever location, a veterinarian who generates the final report on the analysis.
That is very correct. So while we are performing a service that is highly specialized, we do not interpret on site the findings. The findings are submitted to a specially trained veterinary professional, a doctor called a thermologist, who expresses the opinion or a diagnostic impression based on the material that has been submitted to him or her. And then that report is brought back to the owner, breeder, trainer, or the primary veterinarian as requested for finalizing the discussion as to what is it that the animal is suffering of and what is the suggested treatment protocol that will heal the animal and bring it back to top performance and ideal state.
Well, Tom, let's go look at a horse. We've got one we're going to examine, and let's go find out how we do this.
I'm looking forward. Thank you.
Well, we'd like to take a moment and thank people who make Speaking of Horses TV possible. We want to thank One Source Nutrition, the perfect blend of nutrients to help your horse. It's One Source Nutrition. And Revitavet, equine light therapy, for either toning up muscles before competitions or to promote rapid healing. You want Revitavet. Equine Savings. This program can save you up to 25% on tractors, stable equipment, yes, and even on barn paint. Be sure and go to Equine Savings and check it out. To Hoosier Horse Trailers. Quality horse trailers, living quarters, you and your horse can ride in comfort. And SARATOGA Stalls, classic equine stalls built specifically for you. Thank you to SARATOGA Stalls. And thanks to everyone who makes Speaking of Horses TV possible.
We are at the beginning of the thermography process. We're going to be imaging our next patient. His name is Saint. And we are going to be performing a full body thermography on this horse, trying to pinpoint where the injuries and ailments are originating and what is their nature. So the first shot will be an anterior view. Sarah, if you would not mind, could you please raise the horse and square him off so we have a perfectly symmetrical. Okay. And excellent. We're going to be progressing towards the knees and ultimately down to the hoofs in order to get a full, complete set of the front view of the animal. We can even take a beauty shot of the face. Sometimes it's to the delight of the owners. Okay, there we go. Now, in order to have a complete and full view of the horse, we will have to move around and make lateral shots on the left and the right side, ultimately progressing to the back of the animal, and we're going to be doing the back view and the dorsal view of the animal. Here we are ready to take the lateral shots of the horse. A distance of about 6 feet will be satisfactory for that, because we are hoping to accomplish the full body imaging of the horse. As we are zooming into the regions of interest, we will have to take a few steps closer in order to get a perfect shot of the suspected area. So I will demonstrate it in the next few moments. Sarah, if you would not mind holding him squared off, we get an ideal shot of his neck. Okay. We have to get our equipment here cooperating first. Recalibrate? Okay. Here we go. Okay. Neck. The idea is that we have to have an animal perfectly squared off, and we have to take the particular screenshots in a 90-degree angle in order to get the best visibility and specificity of the scan. So we're going to be zooming in towards the shoulders and the knees, and ultimately the hoofs, which will require of us to get closer to the animal. He's doing great. He's a great subject. Not very fidgety at all. Enjoying almost the process. Sarah, would you mind for the ideal shot, just moving the animal forward so the closer front leg is forward, whereas the right is back. That way we are able to make the distinction. Great. We can work on this. This will work.
Hold on 1 second. All right.
Yeah, if you can keep him steady that way, I can get the shot just fine. Action, okay. Here we go. That will work.
Okay.
That will show clearly what angle and which part of the body are we scanning. So the thermologist, the interpreting veterinarian, can clearly determine the area and the region of interest we're looking at. Okay, so we got the front extremities. We have to remove all the mane and hair at the time of our screening, because any kind of hair acts as an insulator, and therefore we cannot get the proper temperature reading of the animal, and hence we cannot analyze the issues that are at hand. Okay, a close-up view of the lateral. Oops. There we go. This is the next step in our imaging process of the horse. We're going to be finishing with taking screenshots of the horse's back from various angles, which ultimately can lead us to the origin of the ailments or injury. Many of the injuries originate in the spinal region, be it in the, let's say, the upper end, around the neck, or around the pelvis. And that gives the interpreting thermologist, the veterinarian specialist, the opportunity to have a well-rounded picture of what's going on with the horse. Okay, he's doing very great, very good. This is often a very technical shot because the animal is under a certain angle and I am not in a natural stand. It can take a few moments and a few tries. Sarah, if you would not mind pulling him a little bit forward so I can get closer to the get a better view of the crook. Okay, nice and steady. Excellent. And you're set. Thank you. So in order to get a thorough picture of what's going on with the horse, first we are trying to get scans that are more general and they are focusing on the larger areas of the animal. However, the more technical shots or the screenshots or images will give us the answers as to what are the specific regions of interest we should be looking at. For example, does the lameness originate or is associated with the injured fetlock or cannon of the horse, or is the origin of the issue somewhere in the pelvic or spinal region of the animal? And I will demonstrate the shots of the back of the knees. Not just the frontal view, and then we're continuing down to the cannons, to the fetlocks. Ultimately, we're going to be taking a closer look at the bottom of the hoofs to see if we are finding any kind of indication of either inflammation or perhaps a nerve damage that is causing the animal pain and leading him to be lame. Sarah, would you mind picking up the horse's left foot, but without necessarily touching the pastern area, so we get a Great, thank you. And here we're gonna have a very nice shot of the perfect. So our initial scans of Saint that will be submitted to the specialist veterinarian called the thermologist for interpretation are showing some interesting results. Of course, we are not veterinarians, we are not diagnosing right on spot the situation or the ailment of the animal, but we are seeing certain patterns that will be of interest in formulating the final veterinarian diagnostic impression. So right here, as we took a shot of the horse, Saint is definitely showing a inflammation in his right shoulder that is indicated by the red and white spots in the given area. Is that a primary issue or is it just an effect of something else is of course the subject of the discussion and ultimately of the investigation that is going to be done by the thermologist / specialist veterinarian. A report will be ultimately provided at the end of the assessment, and the report will be presented to the owner, Miss Sarah, and her primary veterinarian in order to conclude the assessment and finalize the diagnostic impression. So we are seeing here a perfect hoof, perfectly healthy hoof. As you recall from our scanning session or imaging session, we took a close look of the hoof that was suspect, and actually we took a close look of all of the hoofs in order to get a correlation on what's going on with the animal, what's causing his lameness. The animal was short stepping, and as it turned out to be that the suspected front left hoof might be the area that originates or causes the lameness, it turned out to be incorrect, and seems like that the front left hoof actually is perfectly healthy. So the thermologist will have to look for the cause of the lameness in somewhere else, which is their specialty. Sarah, thank you for inviting us to perform thermography for your horse. Would you mind just quickly recap what seems to be the issue that we're going to be hoping to find answers for?
Yes, well, this is a Saint, and we usually use him on our wine tours. He started to show a little bit of soreness and then lameness in his left hind leg. The vet was thinking it could be stifle, then it was looking like it could be hock, and instead of doing some localized x-rays, we decided to go with thermography and get some overall full body images, so we could get a clear picture of what would help him best, so he can come back on the tours when he's healthy.
Wonderful. Thank you.
We at Speaking of Horses would like to thank some of the people who helped to make Speaking of Horses TV possible. A big thank you to Equine Clot. Equine Clot is a wonderful product. Carry it in your saddlebag, put it in your first aid kit, wrap it on an equine wound. It immediately promotes clotting and is a great first aid tool. Thank you to Equine Clot. And to EquestraSafe, a complete line of equestrian riding products for trail, for arena, for wherever, from reflective vests, reflective headgear, tapes, signage, everything you need to ride safely and to be safe with your horse is available at EquestraSafe.com. Check them out. Thanks to all of the fine people that make Speaking of Horses TV Well,
Possible.
that's our Speaking of Horses show today. We're really glad to have you join us. We've learned a lot about thermal imaging, and a big thank you to Sarah,
Thank you very much.
and a big thank you to Tom.
Thank you very much for the opportunity, Sarah. Thank you for choosing us, for performing the thermography on your horse, and we are looking forward to deliver you the results as soon as the thermologist will have them ready.
Great, thank you.
And thank all of you. That's our show for Speaking of Horses. We'll see you down the trail.